This is a story of a 41-year-old female, Karen, who came to see me after a long course of diagnosis, treatment of a very advanced stage breast cancer, diagnosed initially in May of 2012, status post right mastectomy and lymph node dissection. She explored many alternative therapies as she did not have faith in conventional medicine. Unfortunately, none of these alternative therapies during this 2-year journey did work for her. She tried IV vitamin C, went through many diet manipulations, as well as alternative therapies, supplements, and other modalities that none of them was able to regress the disease. In fact, her disease got progressed very rapidly in the last year before she saw me. She saw me in August of 2013 after all these treatments and very advanced disease, which we identified the progression of disease in the lungs. She had multiple pulmonary nodules, too numerous to count, with a very high metabolic activity identified in the PET scan. Very disappointed when she came here from all sorts of alternative therapies, but she still had the faith on trying other modalities, as at that stage none of the conventional therapies were curative. In fact, with a stage 4 breast cancer, with that stage of advanced disease in the lungs, there was no chemotherapy that was suggested to her by anyone, and merely the palliative care was an option for her. So she came in August. We started her immediately after doing initial PET scan and drawing some blood, which showed extensively high tumor markers, CA 15-3, 27-29, CA125, and other markers. She started IV epigenetic therapies that we have invented and patented, called multi-targeted epigenetic therapies in our clinic. She received them very faithfully. She followed all my recommendations, and she stopped doing other modalities and getting other IV therapies at other Orange County clinics. So after just 10 treatments, we were able to identify a quick response in her markers. She had a drop instead of increase on all her markers after 10 treatments. We continued the treatments with the PET scan, restaging PET scan in November last year, which showed a drastic response, more than 60% decrease in many of the lesions, metabolic activity in the lymph nodes, chest, as well as the breast. She decided to continue the treatment with us, and at that time we were able to monitor her, and we were able to show substantial decrease in all the markers as the time passed. So in January 16th, we did another PET scan, and this time around we showed almost complete resolution on all her pulmonary metastatic disease. She had no lesions identified this time around with any metabolic activity, and a variety of lesions, it just disappeared. And in fact, the radiologist commented that there was a suspected minimum residual disease rather than any sort of activity, which was almost as good as a complete resolution or response. She had no pulmonary lesions identified this time around. All the lymph nodes in the hilar mediastinal responded. All the axillary supraclavicular lymph nodes, they all disappeared. And she has a clear scan pretty much at this time. And we are looking forward to continue her treatments. This sort of a response that you see in a very advanced stage 4 cancer is unheard of using any sort of therapy. Both conventional and alternative medicine is not documented in almost any patient in the history of treating cancer that a patient with stage 4 disease is able to get rid of these lesions almost to a complete remission. just using IV epigenetic therapies or any sort of therapies that I'm aware of that is available in the country and beyond. So we are very happy to see her at this stage now, that we are able to taper down her treatments down to a maintenance way, that she only comes here once a month to keep these lesions as minimal activity as you see now in the PET scan. We did a blood test and all her tumor markers have dropped again and normalized. So we're very excited, and we think that this is a great news for patients with advanced cancer, that unfortunately all the doors are closed when they go to their conventional oncologist. They offer them only an option of palliative care with no hope. In fact, the only thing that she was offered was just a palliative therapy that could probably not even extend her life beyond what is expected at this level. Now we're looking for somebody who can live normal, who can stay alive as long as it takes, and perhaps never die of cancer ever. And we're happy to share this with the public, with other physicians, with other patients who are suffering from this sort of disease, and all the doors are closed to them. We are the hope. Thank you.
Hi, I'm Karen Alston, and I was diagnosed with stage 3 breast cancer in May of 2012. I immediately had a biopsy done, and they found it was invasive ductal carcinoma. At the same time, I had some friends that were nutritionists and were involved in the naturopath world, and went through and interviewed with all the regular surgeons and plastic surgeons, and at that point realized that it wasn't for me. And so I went through and started therapy with vitamin C and sodium bicarbonate, and got my condition stabilized within 4 months. And within 6 months I went back to work and kind of kept up with, I became a vegan, and the diet helped a lot to stabilize the condition as well. So about a year and a half went by, and started noticing that the tumors in my breast were becoming unstable again and becoming very large. So I opted to have surgery, and went through a couple different doctors at that point, and noticed that I had some regrowth in tumors after the first surgery, and realized I needed to be more aggressive, and started looking elsewhere, and talked to a chiropractor at the time who referred me to Claudia Arola at the OC Brain and Body, and went through some treatments with her, and she referred me to Dr. Nizami, and had my husband go online, and we looked at his videos and read about him, and noticed that he seemed to be a lot more knowledgeable than any of the doctors that we'd spoken to in the past. So we set up an appointment with him, and met with him, and knew right away at that point that that's what needed to be done, and went through the first 10-day trial, and Dr. Nizami said that I had a great response. So we continued with the treatment. It was at that point we did the first PET scan, and went through all the individual testing, and we had the diagnosis that it had spread to my lungs. So I knew after the 10-day treatment that Dr. Nizami said it would be probably a little bit longer to take care of the lungs. Had another PET scan in 3 months, and showed about 50 to 60% improvement in the lungs. The cough that I had also started to disappear, and at this point has completely gone. Had another PET scan. Now we're in January of 2015, and the last PET scan showed almost a lot of areas resolved, and with just a little bit of residual disease left over. So for stage 4. That's amazing results, and I can't thank Dr. Nizami enough for giving me the opportunity to reach that. The staff here has been wonderful, and to anybody who has gone through as much as I have, it's probably a life-saving decision that will help anybody who was in my boat. So thank you very much. I continue to have treatment, now down to 1 day a week, and hoping to keep stable, and at this point I still am. So I'm very happy for that. So thank you very much.